Our first question for Dr. Mingle today is from Kenneth, and Kenneth asks, how do we help our providers stay motivated about their Mips performance?
Well, thanks, Ken, for such a great question. Couple of pointers to keep your providers motivated. One, we all tend to be motivated by measurements. So when we're measuring, you may have heard the old saying, people improve what's measured. And of course, measuring itself doesn't keep it at the front of your mind. It's reviewing those measurements, keeping them visible. So I'd say that would be my number one recommendation. Keep the numbers you're trying to deliver visible to your providers. Update it at least quarterly, if not monthly. I don't see a lot of advantage to doing it more often than monthly, although you could get into a rhythm of that's more frequent. And as a group, as a practice, review these regularly. Ask those as you review them. Ask those questions. Well, how do our high performing teams get to that high performance level? What challenges do our lower performance teams face to become a higher performing team? And of course, if you're a small practice and you're one team, maybe even break it down by patients. How did you get to success in the patients that are in your performance met category? What are the challenges to get those who didn't get to success? What are the challenges of getting them there? But don't just think about the care. Our measurement system is not just looking at the care. There's lots of failure points. And you should be looking for those failure points. Who's asking the question? How do you find that a patient needs something? How do you recognize that? Who recognizes it? Who records it? How and where is it documented in your patient record? If you are recording it, if it's been done, you're recording it, is it being captured by your measurement system? Are the queries that are being done really showing those patients to be performance met when they should, and appropriately putting them in performance not met? Audit specific patients. And I would, if you're using our system, you'll be able to get down to a list of patients to go into each measure and whether they're performance met or performance not met or exceptions for some reason, and pull out a handful of those every time you're reviewing it to look and see are they appropriately in those categories, and if they aren't, why not? And there's many failures of the documentation and query system, and some of my best clients' practices are every year, over many years, they're steadily improving their systems, finding errors in the templates that create their notes, and errors in the database that they lose data periodically or at least from the measurement system. And finally, build it into your incentive payment formulas. And I would actually put this as the lowest priority. I don't think we have to build it into the incentive payment formula to get people to take it seriously. The other things I've mentioned, I think, are more important to actually get to improvement. But I think a lot of people find that presence in the incentive payment formula to make it a lot more interesting for providers.